This video is going to be about the bones of the skull and the features of some of the bones. So you want to think about the bones of the skull as if, is there a single bone, meaning it's unpaired, there's only one, or is the bone paired, that there are two, a right and a left? So this is the frontal bone, and you see these orange squiggly lines, those are the sutures, those are joints where bones come together. So this is the frontal bone. It's an unpaired bone. And think of your forehead as your frontal bone. And then also, look, this is where your eyebrows would be, right? So that's part of your frontal bone. Okay. If we turn to the side, this is a parietal bone, and those are paired. So this is the left parietal, this is the right parietal, and this is the suture between the two parietal bones. On the back of the skull is the occipital bone, and that's unpaired. There's a single occipital bone. And you're probably also learning the names of the sutures. So you can see this suture between the occipital bone and the two parietal bones. So this is a suture that has a name, this is a suture, and that's a suture. Those are the main sutures. So let's go back to the facial skeleton. So this, the cheekbones, that's the zygoma or the zygomatic bone. So they're paired, right and left. This is these are the nasal bones, right on the bridge of your nose. It's paired, right nasal bone, left nasal bone. Okay. This big bone that's here, that's the maxillary bone or the maxilla, and there's a right and a left. Most of the maxilla or the maxillary bone is hollow, and there's a sinus in there. If you've ever had a sinus infection, you might have had cheek pain. Okay, the frontal bone also has sinuses. A sinus is an open cavity, and it's lined with a mucous membrane that's similar to the lining of your nasal cavity. And if there's excess mucus or an infection in your frontal sinus or your maxillary sinus, it will drain into your nasal cavity and then maybe back down your throat. Okay, so maxillary bones or maxilla, and notice the teeth. We've got a whole, our upper teeth are our maxillary teeth. All right, now let's look inside the orbit. So we see the maxilla bone forms part of the floor of the orbit or the bony eye socket. The zygomatic bone also helps form the floor. On this medial wall, there's a tiny little bone there, lacrimal bone. And that lacrimal bone, lacrimal means tears. So we see this opening there for the nasolacrimal duct where our tears will drain into our nasal cavity. All right, this bone right here on the the lacrimal bones are paired. There's two. This is the left one. Inside here on the medial wall of the orbit, that's the ethmoid. That's part of the ethmoid. And the ethmoid bone is about the size of a walnut, and it is a single bone. It's unpaired. Okay? So that's the ethmoid bone. Now, if we look back here, this lateral wall right there, and in the back, that's the sphenoid. The sphenoid. So let's see where else we can see the sphenoid. That's an unpaired bone. So I'm going to turn the skull to the side. This is part of the sphenoid. Right here. If I take the top of the skull off and we look inside, this is all sphenoid. That's an unpaired bone. And it's usually described as having wings like a bird or wings like a butterfly. I mentioned ethmoid back here on the medial wall of the orbit. Well, we can also see the ethmoid from here. This is all ethmoid. And the ethmoid, remember, is an unpaired bone. All right. Inside the nasal cavity, we can see the bony septum. And the most superior part of the septum is a perpendicular plate of the ethmoid bone. So back there, coming from the roof, is the perpendicular plate of the ethmoid bone. This bony septum that's coming up from the floor and going up, that's called the vomer, V-O-M-E-R, and that's an unpaired bone. So the ethmoid, it's perpendicular plate, and the vomer together form the bony septum. And then the rest of the septum is cartilage. Okay? If we look on the lateral walls of the nasal cavity, we're going to see 3 curved bony shelves. Really, we're only going to see 2 because the third one they don't add to the model. So the inferior one, let's see, I'm going to point like this. Is that good? That inferior one, that's the inferior nasal concha. And that is a bone all by itself. So there's a left one and a right one. So this is the right inferior nasal concha. If we look up, that's the middle nasal concha, and that's part of the ethmoid. And then the superior nasal concha is part of the ethmoid, but we can't see it. It's way up there in the roof. Okay. Let's talk about other features of the ethmoid bone. So we're looking inside the skull. The brain has been removed. We see 58 is a vertical projection of the ethmoid, and that's called the crista galli. And then on either side of it is the cribriform plate with lots of olfactory foramina. And that's where the olfactory cranial nerve 1 sits, and the little nerve fibers go through those foramina and end up in the roof of the nasal cavity. Let's stop there. Okay.